Excess soft tissue in the posterior neck region or redundant nuchal skin folds are seen in 80% of newborns with Down syndrome. A 21-week fetus with Down syndrome has an increased nuchal skin fold thickness, 10 mm, as seen by a transaxial plane into the fetal head's posterior fossa. In this sonogram, the second trimester's typical nuchal fold thickness, as seen from the posterior fossa, is 0.41 cm. The difference between both nuchal fold thickness is quite obvious. Other chromosomal disorders including Turner syndrome, trisomy 18, and 13 also show nuchal thickening. In certain instances, it can even be the result of the resolution of a cystic hygroma. Benacerraf was the first to identify trisomy 21 sonographically in 1985 by describing enlarged soft tissue in the fetal occiput between 15 and 20 weeks of gestation. The authors reported that a nuchal fold thickening of more than or equal to 6 mm was present in 33% of fetuses with Down syndrome. The thickness of the nuchal skin fold can be obtained by passing a transaxial plane across the fetal skull and angling it posteriorly to include the occipital bone and cerebellum. The cisterna magna, cerebral peduncles, cerebellar hemispheres, and cavum septum pellucidum are important internal anatomic landmarks. Calipers are used to measure from the exterior skull table, or outside the occipital bone, to the outer skin border. Measurements are usually taken between weeks 15 and 21 of pregnancy. Values of greater than or equal to 5 or 6 mm are considered abnormal or increased. Although it has recently been demonstrated that absent nasal bone has 41% sensitivity and 100% specificity for fetal Down syndrome, the thickened nuchal fold is one of the most significant marker and the most sensitive and specific single marker for the mid-trimester detection of Down syndrome. In light of these findings, even in low-risk populations, genetic amniocentesis need to be made available whenever an abnormal nuchal fold measurement is detected. It's crucial to remember that while some trisomy 21 fetuses may experience nuchal thickening during the second trimester, other fetuses will completely resolve. An amniocentesis should be offered as soon as an abnormal nuchal skin measurement is obtained, regardless of whether the nuchal skin thickness resolves, because regression may occur whether or not the fetus has Down syndrome.